Welcome back. The CDC has cleared booster shots of Moderna and Johnson & Johnson's COVID-19 vaccines, giving people now the freedom to mix and match any of the three vaccines approved for use here in the U.S. Now, that means at least another 50 million more Americans are eligible for a booster shot. Joining us now is Dr. Calvin Sun, founder and CEO of the Monsoon Diaries, also a clinical assistant professor and attending physician in emergency medicine here in New York City. Dr. Sun, always good to see you. Let's just try to make things less confusing for folks hearing this news right now. Who actually is eligible for these booster shots, and how should they approach mixing and matching?
How do you define eligibility? Technically, these are recommendations. So if you want to go to a drugstore right now and get a booster shot, no one's going to arrest you. No one's going to say no unless they're worried about their liability. Really, anyone can go in a drugstore and say, I never gotten a booster, lie, and get a booster shot for the sake of protecting their kids or loved ones. But the recommendations as it stands right now is that you shouldn't get a booster unless it's been at least 6 to 8 months since your last booster, if it's an mRNA vaccine, a Pfizer or Moderna, or 2 months since the Johnson & Johnson. If you would like to mix and match, what they're saying is that there's no demonstrated harm by those who already have mixed and matched from the existing data. If you want to take that chance, that's on you. It's a personal decision. But given the chance of getting infected with COVID, do you want to wait too soon, wait too long? If you wait long enough, 6 to 8 months, 8 compared to 6, you will have a longer lasting protection as opposed to getting your booster shot 3 weeks later, 1 month later. The longer you wait, the longer the lasting immunity and protection is. But the irony is if you wait too long, that gives you a higher window of getting reinfected. Therefore, it's a complicated decision, and it's a personal one based on your risk tolerance and your exposure. So for myself, I got the third booster 2 weeks ago of Pfizer because I work in a high-risk occupation, an ER doctor, constantly traveling as well. So therefore, that I decided with my age range and my, I have no medical history, to get the third booster based on my risk factors because I'm exposed to positive COVID patients every day in my work.
Well, congratulations to you on getting that third booster shot. I think Alexis and you both hit it on the head because there is so much confusion, right? And it can be complicated to make the right decision. And there has been so much apathy towards even getting a first shot in this country. The federal government has tried really hard to push that vaccine mandate on companies and to get people to inoculate themselves. But do you think it's going to be easy to get that third shot in some cases into people's arms?
It really depends on where you're talking, who you're talking to, where in the country you're talking to, and the context in which you're talking to. We assume that there's so many people against the vaccine on the surface, but as I had said in my program 2 to 3 months ago, we've had plenty of so-and-so anti-vaxxers come into my emergency rooms, and thank goodness for patient privacy laws, they got vaccinated and they went straight back out telling their friends they never got vaccinated. So there are people like those. The messaging is coming out that where enough time has passed where people can look back, and it's been a year. More people are still dying from COVID than people who are getting harmed at all from the vaccine. It's not 100% and it's not 0%. You're never going to get black and white in medicine and in health, but it's the overwhelming odds that are working against you if you're unvaccinated during the middle of a pandemic. So people who are over 65, immunocompromised, soon kids under 12, these are the people who are the virus, especially the variants, are having a field day infecting because they don't have an adequate protection of those who are fully vaccinated without a medical history who are not immunocompromised.
Yeah, doctor, to bounce off that, we heard from Pfizer, good news there. They said their COVID shot is 90.7% effective against symptomatic cases in kids 5 to 11. I know next week the FDA is going to take up whether or not to approve that vaccine for children in that age range. What's the timeline like? When do you think we might expect younger children to be able to get at least the Pfizer vaccine?
Pretty soon, we hope. But again, I'm not very good in the business of predicting things. But we had just talked about stocks and investing and whatnot. We look at trends. We don't look at a single point in time. This is the time to buy now. We look at overall trends. What are you betting on? And right now, we're betting on the data that everything's 90+%. After not, I think for adults, it's 97% if you get the third booster of Pfizer. So 99.99% of people who are fully vaccinated do not end up in the hospital or die. It's not 100%. So if you want to bet on that 0.01%, you're risking it. You're betting against the house. But if you want to bet on the 99.99% so far, and it's been day and day and day of data for a whole year, the trends are moving towards hopefully sooner than later, hopefully by around Halloween time, Thanksgiving. So you would have as normal as possible of a holiday season pre-pandemic.
The U.S. is opening up next month to international travel. What impact do you think that has on case counts? Should we be worried at all? Because we are seeing a rise in international cases in the UK, in Germany, and New Zealand, for example.
So I have had the pleasure and privilege for having traveled every month in the past 6 months since last May, June, internationally. I just got back from an international trip 2 weeks ago. I've taken over 400, 500 people with me, all of who tested negative for COVID, even after the trip. By this point, it's been almost 2 to 3 weeks since my last trip. It's not going to be anything, COVID related at this point. So I learned from other countries is that very strict on only taking vaccinated people of a certain type of vaccine and getting a negative PCR before you board and when you arrive, and multiple PCR tests when you're there, let alone getting tested. United States of America won't take you back, even if you're fully vaccinated as a U.S. citizen, unless you have a negative test before you board. So all those factors in place, it definitely you can slip through it, but you're really minimizing risk now when you're fully vaccinated with a negative COVID test before you travel. And I think with the guidelines in place where the United States of America are opening up to international travel, they are requiring fully vaccinated people of a certain type of vaccine that's trusted with good data behind it, as well as a negative test. If they're making U.S. citizens they're forcing us to take a negative test before we board on our flight, even when fully vaccinated, I'm pretty confident. But it also depends where they're coming from and whether the people who are guarding these borders before they arrive are actually sticking to the rules. And, you never know. There's a lot of different airports who have different security systems when they come back in, and hopefully they are abiding by it and, paying attention.
Yeah, it's one of the big challenges. Have to stay diligent and not out of the woods yet, for sure. Dr. Calvin Sun, thanks so much.